of the resources that we currently have, and we should also look at innovative ways to finance our maternal, newborn, and child health.
Thank you very much. Dr. Haddad.
United will be the best.
United will be the best. I thought you were going to say united we stand, together we fall. United will be the best.
So we shall continue our effort, all of us, to improve our maternal and neonatal child health, child also development, and so on. So I'm so happy that we have gathered a lot of stakeholders here. Let's stay united and keep on walking.
Thank you, Dr. Edwina.
I would say that the main enemy to achieving our aim is poverty. Poverty of the countries, poverty of the citizens. So whilst we are trying to achieve this goal, let's address poverty. Let's see how we can address poverty, improve household incomes so that people can make improved choices, health choices, and that will go a long way to improve maternal and newborn and child health.
Thank you so much, Dr. Edwina. Thank you, Dr. Haddad. Thank you, Dr. Catherine, and thank you, Miss Irene. Are we able to take some questions from the floor?
I have to sum up. So this has been a brilliant panel. Let's give them another round of applause. My take home as a summary is that when we're looking at prioritization and optimization, let us not just think about the immunization side alone. Where I sit now, having worked within the development sector and now more or less fully in the private sector, there are certain outcomes and where we are today in many areas that if we had optimized, we'll be far ahead. We spoke in different areas, including digital health. And I feel like, what can we say? Okay. We were one of the first that started digital health. We had the Rwandan team coming here to learn. I've been there several times and I've compared to where we are today. We had $100 million investment in electronic medical records over the last 10 years. Think about these things. I continue to say that one of the weaknesses of our system, despite funding, that's why I like your answer. You said, when he asked us for funding, you said, you don't want to say no, because it's not always about funding. How are we optimizing the resources that we have, that are dwindling, that have been made available? And it takes courageous clinicians, as we call it today, to be able to ensure that every chain that we participate in is being optimized. It's not always because there's no funding. Private sector involvement is key now. And I've been in the private sector now in different areas, talking to Ministry of Health. When you go back, you talk to our private sector reps in different sectors, they've seen the public sector as very wasteful. They've seen over 10 years the analysis of support, whether it's e-pharmacy, e-learning, school health, electronic medical records. I'm just thinking about just one area. And they ask ourselves, when they sit down, they ask and ask, Henry, you have been in, I've been in development before moving there. The analysis are not things that we can write home about because we have not optimized these resources. So the private sector had been ready, but they are asking questions. Again, whatever simple way you bring the private sector in is important. I can give you an example. At Ghana Canada Medical Center, it's a private for-profit center. But they decided that immunization activities, they'll provide canopy, they'll give people some drinks. So EPI, the outreach teams, when they can come there and can be able to use the environment for the catchment community too. So we need to be looking at how we can leverage all of this and quantify it and show that we are capable. This has been happening in different communities. So that is very important. I would end by saying that advocacy for us to continue to leverage what is possible within our system is important. The advocacy has been pushed to the level where, as I speak, and some of you might have heard about it, that there is going to be a free primary health care. I'm not a policy interpreter here, but because we've all been involved in including the private sector, where when you have your card that identifies you as a citizen, you can access primary health care, even if you don't pay premium for the referral services, because everybody pays the NHIS, wherever you buy. So, yes, there are issues, but we have a solid potential that we can leverage and tap into to withstand some of the shocks that we are thinking about. And we have been preparing for pandemics in terms of all the surveillance and things that have been going on for a period. We are not yet at that level. So this is what I would say. And the clarion call is, wherever you find yourself, be courageous and ensure that anything that you are working with is being optimized. Because the times are not as it used to be 10 years ago. Thank you.
Thank you. Thank you so much, Mr. Chair. So in conclusion, ladies and gentlemen, let us choose action over inertia for every mother, every newborn, and every child. Thank you all so much.
Thank you. Thank you very much. So, like I mentioned at the beginning, the co-chair was dealing with some money matters as a PSG financial secretary. So she should just say some few words just for 2 minutes and then take your seat.
Thank you very much, Gavi. I think they've said it all. Efficient use of the resources that we have. The only thing now to add to that is a paradigm shift, a change in our mindsets. As we go through this program, one of the things, panel discussions, presentations, all we are attempting to do is to change your mindset, how you look at child welfare, how you look at newborn and maternal health, how you target some of these things, how you advocate for the child. It all begins with a change of mindsets. The things we used to do before were not working. We are doing something new. And with something new comes with new information, evidence-based. And so efficient use of resources, learning more, reading wide, change your mindset to apply new things to ensure that we do the best for the children. Thank you very much, everyone. Thank you, Gabi.
Thank you, Ifwa. So our next presenter is a fellow of the West African College of Physicians and also a fellow of the Ghana College of Physicians and Surgeons and also fellow of the Colleges of Medicine South Africa. He's head of unit and a senior specialist in pediatric intensivist at Confanoto Teaching Hospital. He is the president-elect of UNAPSA and an active member of the Pediatric Society of Ghana, and in fact, our immediate past president after serving 2 terms. He's the team leader of the COVID-19 case management at WHO and a consultant of the clinical management unit. Served as a board member of the
World Federation of Pediatric Intensive and Critical Care Societies, and he's a past executive member of the Africa Sepsis Alliance. His research focuses on child survival, and he has a special interest in emergency and critical illnesses such as sepsis, critical care training, and palliative care in PICU in resource limited settings. Ladies and gentlemen, with a round of applause, let's welcome Dr. John Adebi to take us through the next presentation. He says he will take only 30 minutes of the 1 hour allotted him, so we'll be done very soon.
That's a lot of pressure, but yeah, we work with pressure. So thank you very much. Thanks for the opportunity to discuss the issue of ethics in immunization advocacy. Are my slides ready? But yeah, basically, when we talk about ethics, when we talk about ethics, I think we've all been primed to what ethics is about. We know some key aspects of ethics. How do we mix it in the equation of immunization advocacy? All right, so the fact that I am a pediatrician is an yes, that's a big conflict of interest, but otherwise I would say that I don't have any conflict of interest for this talk. But yeah, we've heard a lot about the importance of immunization. We know the benefits of immunization for the individual and also for the community. We've heard this morning about the health systems, helping improving health systems. And then also the economic benefit of that. If you have worked in the if you work with critically ill patients before, you realize that those who survive, they don't survive free of charge. They survive with benefits. And that benefits lives with them for the rest of their lives, contributing to the NCDs that we are now fighting. So immunization on its own adds a lot to what we have been able, or what we look at in the context of health, the definition by the WHO. For lack of appropriate representation, I'm using this superwoman to represent ethics in the context of that. And then advocacy. The origin of the word advocacy actually came from a few words. I mean, there are a few words that, but basically, it's anyone who's called upon when one is in need. So if you are called to aid someone and then you're able to do that, you are an advocate. It could be used for legal representation, but also used in advocacy these days, more or less. Basically, an advocate is someone who has a specific cause that they are challenged to work on. And the champions we have here, we expect you to be advocates in the next future for immunization purposes. And that advocacy involves communication that we need to be guided with certain principles. Otherwise, it's not any communication at all that we look at. There are several aspects of that, but we focus a little bit on the ethics of communication in terms of immunization, immunization advocacy. Recent experiences have taught us that if we want to succeed, go back to the olden days when almost everybody was following recommendations by physicians and then government making laws, indicate that we need to find a better way of communicating, sharing messages so that we get back on top of what we do. and that ethics is central to immunization or vaccination programs. Individuals' right, because it borders on vaccination, borders on individuals' right, it borders on public trusts, it borders also on the community's protection, community's health, and ensure that the vaccination programs actually rigorously evaluated, and then we know that it's safe for the environment. Basically, we talk about ethics principles that we want to talk about fairness, transparency, and respect for individuals. Overall, what did I do? But overall, it borders on the 4 pillars of ethics that we know. We talk about autonomy, we talk about beneficence, and then we talk about non-malfeasance, do no harm, we talk about justice. Yeah. Historically, this is supposed to be a condition which is virtually eliminated, or not eliminated, but we brought it down completely. And for a long time, as was discussed this morning, till 2011, there were no cases recorded, confirmed cases. But as we said, established from 2023 to date, we've had some cases. And as I said, this is a case that I saw this week. And incidentally, it tells us that we need to double our effort. There have been some challenges and some gaps that is pushing this up. It's not only in Ghana, in the United States, they are having a lot of outbreaks. I remember the FDA just recently, earlier on, sometime last year, FDA decided to cancel or losing the recommendation for immunization. But because of the increasing number of outbreaks, now they are taking back and they are recommending that parents immunize their kids. And this is where we don't want to get to before we start making any recommendation, any challenges. Again, other disease conditions that have been eliminated include smallpox. This one we heard what others that we have also taken out of the system or eliminated because of immunization. We heard about the 6 killer diseases 32 years ago when I started the journey into proper clinical care. We're seeing a number of these cases, but now barely come across. We don't see any of them till just recently. And that tells you not only measles, but we've seen pertussis, which I had not seen for a long time. I have pertussis. I'm managing pertussis for the past 6 weeks on my hand. And this is where we are getting to. So we need to double our effort as champions of immunization. Our advocacy need to be strengthened and then strengthened. Yeah. So for autonomy, we look at decision making, and that decision making is in the hand of the recipient. In this case, it's in the hand of the one we are going to vaccinate or immunize. It's in the hand of the caregiver taking the decision for the child. As the child grows up, as we go to HPV, do we allow kids to make some decisions on their own? I want it or I don't want it. These are questions that as champions, we need to pay attention to. There are some of them we need to work on informed consent. And as we are preparing for other introductions, we need to pay close attention, ask these questions as needed. And then the beneficence and non-malfeasance, there's always weighing the harm. Whatever we do, there's benefit and then there are harms. And then we always weigh the benefit and the harm. You throw that out to a panel of people to decide for the community, and they will say, in spite of this, the harm that can befall, we still think that using this intervention is much better than using nothing at all. And basically, these are decisions that usually are taken by guidelines development committees. The processes through which guidelines are developed are clearly earmarked. There is scientific process, it's reproducible. So for the champions of immunization, I'll come back to this a slide which touches on us as champions of immunization. We need to have trust in guidelines that are generated by whether it's SAGE, the WHO group, whether it's any other group, your country, determining that we need to have trust in that because they have rigorously evaluated the evidence, and based on that, the harm and then the benefits was not decided by only one person. There were experts, and these days we have patient representatives on guideline groups to make that decision. So everybody's interest is taken into consideration. How fair are the distribution of the vaccines that we give out or we use to vaccinate people? Equity across socioeconomic and geographic cultural groups. These are very important. And then global justice in that sense. There are a few things that I think we need to be mindful when we go out and do advocacy. We are not going out to put in coercion to get people to forcefully or force them to make decisions that, oh, accept this. No, that is not the case, and that is not advocacy. Okay, that if we do that, and also coercion actually leads to a point where people begin to rebel. And basically, that's the bottom line. You don't want to get to that point. You need to provide as much information, useful, needed reason why it's important. We don't embellish it, state it as it is. And ideally, you want to state it in the best, simplest form, the simplest English that language that your listeners, your audience actually can understand. Stay away from our jargons, big jargons and stuff like that. It doesn't catch fire. We need to also be trustworthy. We need to be credible, okay, and then transparent in our work we do. Not above all, but all this is underlined by the quality of the evidence that was used to generate the decision to make a particular vaccination a part of the national immunization process. So these should be based on ethical obligation. It's an obligation for us to ensure that that is done. So for autonomy and respect, I think I've touched on this. For the purpose of time, I can't go on and on and on. We need to avoid being manipulative with our communication, not because you want me to take up the vaccine. You know that truly this immunization is going to be good for my child or for me. Not because of that you keep on saying things that you don't find in the literature. Should I go and read and read around it and I realize that this is not true, you dent your credibility. So we need to understand that. And also understand that if a caregiver decides that I am not for this immunization, that is not the end of the road. We still have time. It's a process. You can go on back and forth. What I try to do is we try to create an environment to communicate, to share, okay, back and forth, never get angry. If you are overpowered by the person you are communicating with today or arguing with today, it's not argument, but chatting with today. The next time you get more evidence to come and support yourself. The non-malfeasance, it's all about the well-being of children and communities. In terms of communities, we talk about herd immunity. All right. We have individual patients, like I showed you, one patient out of the millions that we have not vaccinated. The fact that certain population, we did not hit that herd immunity, eventually ends up with others suffering. Okay, but again, these are the things. Avoid harm through misinformation. When Prof. Sado was presenting, actually she indicated challenges that they had in Nigeria. And Ghana's second round of the HPV apparently also has something similar. And it's because of the way that was handled. And we need to pay attention to what we do, what we hear, what we see, and how we are going to address them. If you don't know how to address them, reach out to other people, other authorities that can help you. And in terms of talking about emotional appeals, yes, they are important. You can take people by emotional hostage, take them bondage, break them down with emotional picture, but be careful that this can create problems in future for you. So know the boundaries that you go with emotional appeals whenever you are doing that. So empathy, two things that emotional appeals make carry across is empathy. You don't over empathize. And then fear. You don't create too much fear within the population as if it's not needed. Again, don't cross the line. If you cross the line, your credibility will be at stake. For justice and equity, we are talking about equitable access. An example is the HPV that we rolled out. In Ghana, we decided to vaccinate only females. Why do we leave the males out? It's a big question, okay? We have important reason. It's because of certain factors that were considered. But doesn't that also create stigmatization for the females we are vaccinating? What impression is that creating for the public? Okay, and then for the boys, what impression is that creating? You should be prepared, ready to answer these questions when you are asked in the fairest and then the most objective way if it's asked, come across to you. Addressing structural barriers, I'll get to that event later on, but ethical consideration and advocating for underserved and marginalized communities. So part of being just for the whole society is that we need to speak out for those who are not getting it. Before HPV was rolled out, the rich ones were those who could afford, were getting it for their kids as exorbitant prices. So what is good for everybody, can we advocate for that now as immunization champion? What else is available elsewhere that is not available here, but we think we need it here? We have the evidence to justify that. So in thinking about advocating for more vaccines, we need to look at these considerations so that we don't marginalize some population because of challenges that they have financially, even geographically in some cases. And then stigmatization, I've used one to elaborate that. So what are some of the ethical challenges in immunization advocacy? One is balancing the individual rights versus the public health or public health, more or less the community aspect of that. How far should advocacy go in encouraging compliance? Ethical tensions in promoting mandates or school entry requirement. All right. When I say school entry requirement, in some places they tell you that if your child is not vaccinated, if we don't see evidence of vaccination, the child is not coming to the school. How far should we go? Are we doing that to exclude people or really protecting others in terms of herd immunity in that community? Herd immunity alone enough to ensure that everybody is protected? These are questions that we need ethically try to balance that. And then countering misinformation. A lot have been said about that. We know a lot about that. As champions of that, that is what we are going to do. We need to find a way to be responsible, okay, in terms of that, responsibly claim and then cut out misinformation. It shouldn't come from us, and we should be able to handle misinformation. Avoid shaming and alienating communities. And that is very, very important. It happens in a lot of religious communities. We tend to finger point and this and that and that and that. Yes, these happen in different ways in different places, and you don't want to be in that position. As a healthcare worker, as a champion of immunization, you want to be seen as someone who builds trust, who wins people to your field. Okay, let me borrow things from the politicians. They say democracy is about numbers. So as much as possible, you try and bring people towards you. Still work in terms of the challenges working with media and social media platforms. This morning, we had a lot of media personalities in here. I was impressed with the MC, Omar Usanda, GNA, and others that came around. And that is the partnership you want. As you go back to your communities, you need to look out for those influential people who can help you put that together. we are, or most people are on TikTok, Instagram, and all those social media outlets. You see people, some might come from your community. How do you reach out, or reach out to some of them to see how they can help you do that? When you go out in that way, you have to be as transparent with the evidence as possible. We have what we refer to as policy statement, and then policy pitches, which are short sentences, just 1 minute statement that you can use to get people's attention. And these can be done as part of the processes that we go through. And I think Pediatric Society can look at teaching the champions how to retrieve evidence, how to synthesize evidence, and how to come out with such important documents with evidence that anyone who goes out to make these statements, you know that I'm coming from solid evidence base. Avoid sensationalism, ethical agency versus pressure tactics. In the early days when of COVID, you remember at some point in time, there was a lot of pressure for people to get vaccinated. A number of things happened, but those you don't want to create a situation where eventually it turns around to lead to failure of immunization processes. So what are mandatory vaccination policies? Like Ghana, for instance, we have policies, and elsewhere have policies that we use to guide us in determining who we are going to immunize, who is not going to be immunized. Examples were shared this morning. National Immunization Day, expanded immunization programs, and new introductions as part of the immunization dilemmas, ethical dilemmas. That, again, I cited the example. How did we choose between boys and the females in terms of the HPV rollout? How did we go about it? I'm sure there's evidence there for us to know, but to others, it's something that we need to debate and find out. Ethical justification versus infringement on personal liberties. In US, for instance, some of these have gone through the courts. Ghana, we've not been through the courts yet, but I don't know when these will start going through the courts as we learn from elsewhere. What are we going to say? How are you going to defend ourselves? We need to make room for exemptions, and this is very important. Just that the exemption shouldn't go beyond truly those who are really have justification, whether religious, whether medical or philosophical about that. Again, I used the FDA example, reversing course, just recently, a few weeks ago, the FDA chairperson actually reversing course. One major problem is vaccine hesitancy, which is coming across very strongly, and that's about delay. Okay, sometimes for several reasons, for a number of reasons, and it's reasonable reasons that they don't go in and vaccinate at the appointed time. When they come to us and when we are adjudicating such cases, we don't go around and chastise someone for reasonably having delayed in getting that. But it would be good to encourage the person, next time, please come on time and stuff like that. And then two, total refusal based on no other reason. An example is in Ghana during the COVID in 2022, when we're rolling COVID out, almost 60% of healthcare workers refused or had different opinion about the vaccines. And that's a situation. How do you deal with that? And this, I shudder to think that if 60% us refuse that, how are we going to handle them when we are in a similar situation? So it's very important that we know this and then we address this. And I think that's the part of the reason why the second rollout for the HPV, part of the reason why when information got out, wrong information got out, we dropped significantly in that sense. That tells us that underneath the iceberg, there are a lot of people, that lot amongst here who are waiting for someone to say, don't do it, and they will not do it. Okay. All right. I have spoken, no, I didn't do much about, but herd immunity is collective responsibility, okay, to reduce exposure above a certain threshold. All of us choose and decide to do that. However, someone will get up and say, herd immunity alone is not enough. But we all need to say we need to go above even the threshold of that. So that instances as we are having measles right now, just because we drop slightly, we don't have vaccine for a few months. Now we start seeing more of that. So these are discussion and resource allocation, prioritization. Recent Ebola outbreaks in different parts of the world. In Uganda, for instance, they prioritize health workers, immunizing health workers first. Is it fair? These are questions that we need to answer. But I guess in the nutshell, it's important that we have reasons to do that, important reasons to do that. Ethical consideration during outbreak, who should get it? Cultural and community consideration, understanding local beliefs. It's very important that we don't go in and transplant your belief on someone else. I'm a Christian doesn't mean I have to push my beliefs on a Muslim. The same way we need to consider and talk about this. Just talk about the medical aspect, the benefit for everybody. And that's quite important. In this sense, listening, inclusivity, accountability, and feedback, very important. If you go to a community that you have challenges with as champions, you can sit down and chat with the community. When I say community, the community can be your own colleagues. Okay, the community can be the bigger community you move in to talk to. Can be online community, can be wherever. And this is what you need. First listen. If you listen, you hear them talk. And when you hear them talk, you understand their challenges, you'll be able to sort them out. What is our professional responsibilities as advocate? We have ethical duty as health workers, as NGOs, and as public health officials. Okay, we need to maintain integrity. We need to maintain accountability. Okay, we need to be able to manage conflict of interest and then advocacy as part of ethics. Just because based on, for instance, my religion, I don't want to accept vaccine doesn't mean that I should discourage another person not to accept it. And that is totally wrong, right? Okay. And then the legal policy dimensions, this is outside what I'm talking about. But again, just slightly, I put this in here to know that there are some legal backings for some of the things that we have here. We have our own immunization laws, okay? We international immunization guidelines from WHO, IHR, and then evaluation of policy enforcement mechanisms all over. Now, what does the future hold for us? We have a lot of things coming up. We have new we have new technologies running very, very fast in terms of developing vaccines, in terms of data privacy, and then digital immunization records, where we store them. These are important things that we need to start thinking about that. And then for global pandemics, look at the rate with which we're able to identify a vaccine that works for COVID. It's all because of the new technologies that we have. But there was rigorous in terms of studying introduction of new intervention from phase 1 up to phase 3, phase 4 to be used for safety. These are very important. We need to balance rapid innovation with ethical oversight and then standard procedure. I think this is my last but one slide, but digital health tools to help us work better as immunization champions. We need to look at the options available. AI-driven messages, opportunities and risk. Okay, we need to evaluate that. And then preparing for future pandemics and rapid vaccine development. We don't know when the next pandemic is coming. As we hear, in Africa, we have hundreds of epidemics every year. WHO colleagues here will tell you that they are always chasing an epidemic somewhere on the continent, an outbreak somewhere on the continent. And this is where we need to be mindful. Cholera was here last year or 2 years ago for a period of time. Mpox was here that's the situation you find yourself. So your role, our roles as immunization champions are really, really important. Thank you, and then I will end here.
Thank you very much, Dr. Adebi. Any questions, any comments? Just 2 minutes. Okay, there's one hand up, nobody else, no one else.
Okay. Thank you, Doctor, for the wonderful presentation that you've made. I want to ask this question. Like per your presentation, it means that nowadays, I know that formally there's a public act law that if someone refuses immunization, something must be done. Now that we've learned the ethical consideration, I want you to show more light on that nowadays, if somebody refuses to take any vaccine, would that person be live free? And my another question is that we've learned something today. I've learned something today that we're not supposed to force somebody to take any vaccine or immunization. But at times we have a program like a national program. They will give you a target. And after the program, and the same people also tell you that you didn't meet your target. So you have to go to the people, especially during COVID-19 vaccination. You work, sir. So indirectly, they are pushing us. They know the law, but they are pushing us to also do something. So can you also throw more light on that area for me?
Please, no,
Yeah, okay.
Oh, sorry. Please, just one more, one more.
Thank you, boss, for the presentation. Mine is, you said maybe for religious, medical, philosophical reasons, maybe, as you said, ethical consideration, those people, maybe they can. Mine is, we want to achieve herd immunity and even more. But if the data shows everybody has it, maybe reason based on philosophy, religion, or medical, and maybe we are getting like 60%, or let me use any 50%. How do we go about it? As you said, now there's ethics in it. You can't force, but you know you are not also getting to your targets. What do you do? Thank you.
Okay, thank you very much. The questions are all similar. It borders on the fact that first, I assumed or I got over the laws. That's the reason why I put in that, the international laws and then the country laws. Let me give you an example. During that time of COVID, if you were not, at some point in time, if you were not immunized, you were not allowed to travel. In Ghana, when we started rolling out the vaccination, if you were not immunized, you were not allowed to use public services. So you need to enter in a bank, you need to show that you are vaccinated before you enter the bank. And that is part of the that's the legal requirement. So that's number one, sitting on top. And Ghana's immunization operational framework document actually has those indications where everybody must have that. Again, going to schools, children going to school. If I want to attend certain schools, some of them is the criteria that you need to do that. Here we don't look at, because there are laws guiding that, we don't apply ethics per se. Okay, you must do it to get in there. But where there are gray areas, you are not sure of where things are. Okay, this is where we tend to apply ethics more. But also, as a champion, what you need to do is that, yes, there are these laws, there are people who still do not believe in the laws and go against the laws. How do you help them with that? And this is where ethics will help us navigate that barrier. If you were asked to achieve a certain target, part of it, we need to be educated fully. They shouldn't assume, from what you are saying, we shouldn't assume that if I recruit someone and send a person out, the person can do everything, understands everything. If you were guided in this situation, this contest, given the fact that the law says everybody must be vaccinated, everybody must be vaccinated, okay, knowing that it is good for everybody. That is the reason, that is when we do that. Again, I talked about development of guidelines. When I see guidelines developed by WHO, developed by Ministry of Health, I know the processes. I read about the process, the methodology. I get the trust in the guidelines. If that is not there, it's difficult to get a trust in the guidelines. So transparency as to how things are done, again, is ethical. Okay. When you do it, you need to write it down. This is the process I follow to develop these guidelines. And that
the child was born at formula by allowing the father, her mother,
I do not think we did anything wrong. The purpose is, in fact, we have the law on our side to ensure that every child is vaccinated. When it comes to adults, it's different because the adult can take decision for himself. But for children, anybody who prevents a child from getting vaccination is violating the law, violating the child's act, the Children's Act. It's a clear violation of it. So we didn't do anything wrong. I think where EPI, we really come in with our conversation is, though we have the side of the law, but always we want to go now you are very much aware of the culture within that area. Look of the importance of the traditional leaders. It's important to start engaging them as early as possible. When you have the Queen Mother, you have the such that these were our practices. It's good we allow health service the opportunity to assess the children and provide the care to them. I think it's really going to help and help very well. So I don't think you erred. Please move with clear conscience. You didn't do anything wrong to the baby.
Exactly. I think you did what you did was right. For that particular child, you saved that child from long-term disability, potential long-term disability, and even death. Yes, you have outsmarted the grandmother. The problem will persist in that community. If you go back again, you might meet another grandmother. So the suggestion here, if it's possible to meet the community leaders, okay, because the father, the child's father, actually was the one who permitted you to go and do it. And those, the decisions are made by the men in the community. So if you can bring the men together, sit with the men, this is the situation. Let's talk to our grandmothers. Let's talk to our mothers. Eventually, we will win them to our side. I'm using the word win them to our side. And that is where we'll properly propagate what we believe in them.
I just want to add to what our brother here said. In the Volta region in Ho district, some years back, it was widely published. We had the DC who had received reports from a community, a religious community, that had banned immunization. He organized the military to go there to really cow them. And up till now, even though he's now an ambassador to another country, they have woken up, realizing that you can't subvert the right of the child because very much at stake. Thank you.
Thank you.
Thank you.
Children's Act, right to health. Okay. Yep.
Okay, thank you very much for such a presentation. It's just a follow-up question as to what has been asked already. In recent times, we spoke about schools not consenting, and there's no evidence to show, like if you go to the school and you want to vaccinate the children, or the mothers or the fathers don't consent from our end, is there any evidence to show that this person refused this? Because later on they might come back, yes, we are achieving the herd immunity, but later on they might come back and say that, oh, you didn't. I've had a situation where I spoke to someone to do a client to do something, and the person declined, and then later on when the thing I was saying didn't is likely to happen, she told me that I'm actually in the best position to convince her to do to do that. So we have clients now, people changing their amount. It's just me and you at that moment. So in that instance, what do you do? Especially with the schools, I know my rights parents. You don't know what to do in such situations. Sorry. Last question.
I was going to respond to his. I think that's where documentation is key in everything that we do. For instance, in the situation of the schools, I know in my region, some of the private schools issued consent forms in the kids, their bags, and put on the platform that you should sign. And there's a portion whether you want to accept or you want to decline. And these were collected back in the schools and kept. So that is an evidence that you decided to take the vaccine or refuse the vaccine. So, and in the scenario you give, I'm sure there are ways we can always document, either in the child health record book, you put it there and then you sign. It can be taken out. So that's what I think.
Yeah, thank you very much. And again, it doesn't end there. I think we should go back with such communities. I mean, go back with a delegation, have a chat with, even if it's at the PTA level, okay? Because then the PTA, most parents will be present and they'll understand the implication if one or two students do not take the vaccination in their among their cohort, the implication for their kids. That will put pressure on the school, education, and so on and so forth for the patient. We'll educate the school authorities, educate the parents, and then inform them, as I said earlier. Information is very important. We try back and forth to get everybody on our side. Thank you, and over.
Thank you. Are we feeling sleepy? Are we okay? Some are feeling sleepy. I'd like Dr. Abigail Saki to come and wake us up a bit whilst Genevieve comes forward for the last presentation. So Genevieve is a female executive of the Pediatric Society of Ghana. She's a fellow in neonatology, and her interest lies in advocacy, medical education, and empowering people to improve the health of children in Ghana.
Okay, so please, before the last presentation, please, can we stand? We are just gingering ourselves up and we'll continue. Can we stand? We are stretching just a bit, so please, hands up. Then please down. And then we are going to do a simple exercise. The song, I will make you fishers of men. Okay, so wherever you hear, when the word starts with an M, the men sit down. If the word starts with an F, the female sit down. So, let me do with the vice. Vice, please come. Oh, vice, please come. I didn't. I think this place is fine. So that's how it goes. I will make you fishers of men, fishers of men, fishers of men. I will make you fishers of men if you follow me. Please, are we okay? And there's a Sunday school song, so please let's do it together. Everyone, okay? And we are singing together too. Ready? Go. I will make you fishers of men, fishers of. Please, do you understand? Any word that starts with M, any word that starts with M, the man sits. And any word that starts with F, the female sits. Okay? So please, let's go again, Vice. Let's go again. We are singing the song together. Ready? Go. I will make you fishers. Vice. Fishers of men. Fishers of men. I will make you fishers of men if you follow me. We are not done. If you follow me, if you follow, hallelujah, I will make you fishers of men, fishers of men, fishers of men. I will make you fishers of men if you follow me. I think the females won.
Thank you very much, Abigail.
I think some people had forgotten the agenda. Okay, so my presentation is very short, so please lend me your ears. It's just a summary of all the things we've discussed today. We are going to talk about the role of immunization champions in influencing policy and resource allocation. Okay. So as has been discussed earlier, we've discussed the successful story of our EPI program. We are getting high 90s for most of our coverages. But then we've also learned that Gavi is fading out. We have to be matured enough to take care of ourselves. And then the last presentation talked about ethical considerations. And then I think earlier too, we had some discussion about EPI coverage and how it went in the urban centers and then the rural settings. So the landscape is changing, and that's why we need to take our role as immunization champions more seriously. Please, I changed the slides. Okay, so these are the objectives of my presentation, just two. Who is an immunization champion and what is our role? So as Dr. Adebi was making his presentation, he listed a number of characteristics of who an immunization champion should be. We are supposed to be trusted with the right information, respected people in the community. We are credible, so people can trust what we say. And then we have influence. Everybody has influence, whether in your hospital, in your family, in your church. wherever you find yourself, you have a world of influence to make a change. So immunization champions leverage on their expertise to promote immunization. And it can be anybody. So it can be health workers. When our Nigerian friend was talking, she mentioned that we should look for social media influencers because that's a big thing now. We have researchers, teachers, parents, social service leaders, civil society. And then when the chiefs were also here, we mentioned that they should also be part. So it's all of us promoting immunization. Now, so why is it important? It's important because the landscape is changing. Where before people would swallow sink and hook and sinker everything that was handed to them. Now they are asking questions. They want the evidence. They want some explanations. They know they are right. So we need to now provide the evidence and convince them before they take the vaccines. And then because the funds are also dwindling, now we also have to advocate more so that those making the decisions or those making the resources available would also be more broad-minded. And then we also have to be broad-minded to provide some innovation on how else we can fund and sustain the successes that we have gained so far with the immunization. So our role, it's been said a number of times, we have to influence our policymakers, we have to promote the guidelines that will be churned out, and then trust the resources that the national policy frameworks bring out, because it goes through rigorous processes before they bring out such recommendations. And then there are always new vaccines. How do we advocate for them? And how do we engage our institutions so that we can get our vaccines, what we have, and then even the new ones rolled on? So with resource allocation, we have, it's been said a number of times that we don't have the, somebody actually said earlier that we are not a poor nation. I think somebody from the vaccine industry said that Vaccine Institute, that we are not a poor nation, we are a low middle income country. And I think Dr. Nagai also mentioned that our indices have changed. So now you can't change the numbers. We have growth, and that's why Gavi is fading out. And we have to now look at other ways of getting funding for immunization. So how do we as immunization champions do that? In our various regional hospitals, in our various district hospitals, how do we do that? It's by providing the evidence. If we engage the communities more, then with time, the communities, I think one of the WHO persons said that what he said was the successes of immunization has made immunization a victim of its success, something like that. Does anybody remember? So it's more like we've had so much successes that now we've taken things for granted. That our children are protected. We don't see, I haven't diagnosed polio before. Please, has anybody diagnosed polio recently? I think Dr. David, he mentioned that he's seen pertussis and then measles recently. Please, has anybody diagnosed any in recent times? Nobody. Yes. So it comes to a point that we take it for granted that these things would happen. But now that we are having resources going to dwindle from our Gavi partners, I looked up the funders of Gavi, and it is United States, United Kingdom, the European countries, and then Mills Gates Foundation. Now we know that Trump doesn't, he's more protective of his country. He thinks that we should take care of ourselves. So as immunization champions, we need to, build the community and engage the community to understand that immunization is for ourselves. It's to protect us. That way, there is a community that will demand from politicians, from the decision makers, that this is important. Wherever the funds will come from, we should make it available for it to be to provide the to sustain the EPI. And then I think earlier too, one of the presenters also talked about maximizing what we already have. So the cold chains we have, the opening a vial and using it for 2 or 3 people and then discarding the rest. Maximizing what we have so that the wastage is reduced is also another way to protect the resource that is available to us. For advocacy and stakeholder engagement, I think that as immunization champions, the community you work in, there are various stakeholders. We mentioned the chiefs, their opinion leaders, their headmistresses, PTA groups. They are all influencers. So how do we engage them so that now next time you go to a school, you don't have the resistance that we just heard it in the news, they are coming to immunize people and then they refuse vaccination. We need to be more proactive now in getting people in the community on board so that it's easier to get our targets that we've been given. And then as immunization champions, we would also be participating in meetings, technical workshops in your various regions, because it's your expertise that would influence some of the decisions that will be carried higher up. We've talked a bit about vaccine hesitancy. And I think the approach to that is to get the right information. Earlier, there was a discussion about the HPV and information going out in different ways till the national team brought a uniform message for us all to use. Now, once that information goes out, sometimes it's a bit difficult to correct. So we need to build up our own knowledge, seek more information, get whatever resource we need, build ourselves up with the right information so that we give the correct information. Because once the information goes out disjointed from the people who are trusted as immunization champions, retracting that becomes a bit more difficult. And then those who have taken the lead in the social media would then be promoting the wrong information and actually sometimes using our information because we said this earlier to promote their misinformation. And then strengthening accountability. We have to, it's more like let me give this example. Once, I think at the AGSM, an issue, there were some concerns about the HPV vaccines not being available at places for people to use. And the head of the EPI was a bit surprised because they have enough of the HPV vaccines available in the country. So for shortages to happen, she did say that she would take it up. That's one of our role as immunization champions. Are the vaccines that are being sent to the various units, are they there? Is it being made available? Remember that the HPV vaccine was already being provided by the private sector before the national rolled it out. So this vaccine that is here, that is being provided free, is it where it's supposed to be, or is being moved to somewhere else? That's our role. We need to monitor and make sure that the vaccines are where it should be. It's made available free for people. We are tracking the distribution. We are providing some transparency to the whole process. For the skills we need as immunization champions, there are many. I put this picture of Father Campbell. Anybody who doesn't know him? I flipped the question on the other side. Does anybody know him? Great. Okay. So he's a Catholic priest. He has nothing to do with immunization. But I put him up because he exemplifies some of the skills that an immunization champion should have. He, like I said, is a Catholic priest, but he's well known to be associated with lepers. And he's promoted and made so much noise about lepers, raised funds, provided resources to take care of lepers. And it's not that he has a special way of talking, but he speaks from his heart. He believes in what he says. And those are some of the qualities or skills that I think as immunization champions we should have. We should believe in the immunization. We should embrace it as our own and champion it. We have to have the right information because people will ask us questions. If you don't have the right information, those who are providing all the myth would fill in the gap for us. You have to use your influence wherever you are. I think earlier one of the presentation also said leverage on leverage on every place that you go. Is it a church? Ask for some space to talk. There was one that was interesting to me. It was wedding or naming ceremony. Yes, like everywhere. Let's hammer the information about immunization, networking and partnerships. So I was reading up on some of the immunization champions, and some of them are very innovative. One person was developed an app in his area. So everybody has different skills. So some people have some digital IT skills. He developed so this is not Ghana. He developed an app that would prompt people, his staff, on this person is due for immunization. So that prompt would then activate the system for them to either call the person in or follow up on the person. In other places, it was maternal immunization they were looking at. And this OBG decided that she would focus on prenatal attendance. So what she does is that the people who come for prenatal counseling, for whatever encounter that she has with them, she's educating them about immunization. Remember that in maternal immunization, there are some immunization you can't take while you're pregnant, but you can build up your immunity way before pregnancy with some of the vaccines that you may not have had when you were a child, like rubella, which we didn't have. So that was her approach. So apart from the national policy on how we should conduct ourselves with the immunization and all, we also have to think of innovative ways we can add to the communities that we live in and make the immunization a more community-owned project. Okay. So that's the last slide I have for you. I just want to say that as immunization champions, you are very critical. The landscape is changing. There are a lot of new issues coming up, and you are critical to influencing the immunization in our country in terms of policy and mobilizing resources. And you're also very important in strengthening the immunization system we have in Ghana. And whatever you do, remember that it is not statistics we are churning out, it is human lives we are protecting. Thank you.
Thank you, Genevieve. So thank you, Genevieve. This was so excellently delivered. I remember when Ikea and I were trying to get someone to do this presentation, it kept shifting from person to person. It even landed on me at some point, and then we just thought, Genevieve will do a good job. And I think she has done so well. She was very passionate about it. Yeah, so we are done. We are done. You've all done very well. So I'll have the chairperson for this session give the closing remarks, and then we are out of here.
Thank you very much, Gabby. I think all has been said. After Genevieve, there's not much to say, but to say that it was a very packed day. We know that you've learned a lot. You are all tired. Thank you for coming. My take home today is that you are gold. You're a very vital resource. You're a very vital person as a champion to immunization continuity in Ghana. And we hope you have a good rest, and we'll adjourn for today, and then we'll see you all tomorrow. Sleeping well, well refreshed for another action-packed day. Thank you all for coming, and have a good evening.
Thank you, thank you, thank you. Closing prayer. So I'll call on Dr. Evangeline Odukwe to give us the closing prayer for today.
Please, can we pray? May we be all standing. Right, Father, in the name of Jesus, we thank you for this day. We are grateful for the gift of life. We are grateful that you have kept us up until now. We are grateful for all the valuable discussions that we have had in this room. Lord, we pray that as we step out, that we will be able to put all of this into use to help the children of Ghana and the world at large. We pray that every deliberation, every recommendation that has been made, even the champions seated here, they will be able to use every information that they have gotten today to champion this cause, and that in the end, we will have every cause to glorify your name. We pray that as we go, Lord, you direct our paths, that we may go and meet our family members in peace, and as we return tomorrow, Father, we'll have every cause to glorify your name. These and many more blessings we pray for. In Jesus' name with thanksgiving, amen.
So kindly pick a snack pack on your way out